So we are the Vbac group, and we're just going to jump right into it. Can anybody tell us what is a Vbac? So many hands, my God.
Vaginal birth after cesarean section.
So exactly what we said, a Vbac is a vaginal birth after C-section. What that means is that a mother had one C-section for their first pregnancy, and for a subsequent pregnancy later on, they wanted to have a vaginal delivery. So we're gonna first start with a case of one mother, Catherine, who is requesting a Vbac.
Hi, so this is Catherine. Catherine is currently 6 months pregnant and she's expecting her 4th child. Her first pregnancy was vaginal, but she needed to have a cesarean for her second pregnancy because she was expecting twins. Now for her current pregnancy, she's adamant about delivering vaginally. She believes that vaginal deliveries are natural and beautiful and a vital part of her womanhood. She is an active member of a blog called 4 Secrets of a Vbac, where she is surrounded by other Vbac supporting mothers. After becoming more informed and reflecting on her birth history, she decides that vaginal delivery is the best delivery method for her. Therefore, Catherine is requesting a Vbac from her physician. What do you guys think? Do you think her physician is going to, what do you think the physician is going to say when she asks for a Vbac?
Depends on the doctor.
That's so dangerous.
What else?
Go, girl.
Go for it.
Yeah.
Okay, well, her doctor is Dr. Sarah Johnson, and she is an attending at St. George's Hospital, and she's Catherine's OBGYN. She was also Catherine's OBGYN for her first 2 pregnancies, so she's very well aware of Catherine's birth history. So Dr. Johnson is actually saying no to giving Catherine a Vbac, and not only is she telling Catherine that she shouldn't have the Vbac, she's outright refusing to do the Vbac. She's very, very adamant in encouraging Catherine to have an elective C-section for her current pregnancy. So we want to see why. Why is Dr. Johnson doing this? So there's a couple factors. One of them is because of scientific evidence. So as a current attending, Dr. Johnson is very well read on all the medical research and all the information that's published in all the recent journals. So a lot of different studies in these journals do say that vaginal births after C-sections do carry a very high risk of complications and risks. So the biggest risk for a vaginal birth after C-section is a uterine rupture. So a uterine rupture is basically breaking through the uterine wall through the past incision of the first C-section. So as you can see in this first image here, here's the scar and it hemorrhages right through that first incision. So this is a problem because then the baby starts being pushed out from that incision into the body cavity of the mother. So this complication can be fatal for both the baby and the mother, and it requires immediate surgical intervention. So the risk of getting a uterine rupture is actually really small. It's only about 0.07% for mothers who are undergoing a Vbac. But there's absolutely zero risk of having a uterine rupture if you're doing an elective C-section. So because the results of this risk can be fatal for the mother and the baby, a lot of doctors who are very well read on these studies are saying no to Vbacs because they rather have a 0% risk with the elective C-section versus the 0.7% risk of fatality with the uterine rupture. So that was one factor that's influencing Dr. Johnson. We're going to move on to another factor, but before we do, we have a question for you guys. What specialty of physicians do you think has the highest rate of malpractice lawsuits?
OBGYNs.
Well, not quite, but you're really close. The number one specialty is actually neurosurgeons, who have the highest rate of malpractice lawsuits. The second one, very, very close second, however, is OBGYNs. So why is this an issue? There are a couple of reasons why malpractice liability can play a factor in influencing a doctor to not do a Vbac. Number one, malpractice liability is extremely costly, not just going through the lawsuit itself, but to cover the cost of the lawsuit, OBGYNs need to purchase insurance. And this insurance can cost around $200,000 a year sometimes, depending on the physician and their past history. So if you think about the salary of a doctor, $200,000 is a huge chunk of that. That's all just going towards insurance. So it's really costly. The other one is that it's time consuming. The physician needs to take off work, take off time from being with their family and friends to have to deal with this issue. Another one, it's really invasive. You're having lawyers and different people come and attack not just how you deal with your patients in your medical practice, but your personal character as well. So it's super invasive. Other one, downright, it's embarrassing for physicians to be sued because of their patients. And the last one, which is really big, is that it taints the physician's reputation. So all physicians, if they have a malpractice lawsuit and they have to pay the claim, they need to register under the U.S. Department of Health and Human Services National Practitioners Data Bank, which is basically a data bank where all hospitals, all hiring services, all organizations have access to. So it's out there for everyone to see. It taints their reputation. So as you can see, there's a lot of really negative consequences that come from a malpractice lawsuit. And because of this, it makes sense that, OBGYNs don't want to do a Vbac that's going to put them at a risk of having a malpractice lawsuit. While elective C-sections they also have risks of complications, and they do sometimes lead to lawsuits as well. Having a vaginal birth, it has a lot greater risks and leads to more lawsuits. If you look at the statistics, a lot more of the lawsuits are from complications that result from just normal vaginal births. The rate is even higher because it's a vaginal birth after C-section, and you have really high risk of complications that are really fatal, like the uterine rupture.
Okay, so for hospital restrictions, the International Syrian Awareness Network has documented that there are about 300 US hospitals that actually ban Vbacs or just do not provide care for Vbacs. And so, often this is because of high costs and limited budgets that kind of factor into limited healthcare supplies as well as low staffing who are trained properly to take care of mothers who want to have a Vbac procedure. And so, healthcare supplies might kind of be the surgical equipment that doctors need to have on hand to provide for mothers who meet complications during vaginal birth. Sometimes, like Silva was talking about, there's uterine ruptures, and if they do meet that, they have to have the proper intrauterine surgical equipment for that. And also, many hospitals have different kinds of insurance, and they have malpractice insurance, liability insurance for doctors that sometimes do not cover doctors who do attend the Vbac procedure. And because of the malpractice liability issue concern, they don't want to have the risk at all for being sued. And so, we have a question for you. So, which state do you guys think has the highest percentage of Vbac procedures?
California.
Yeah. So California or Vermont?
Vermont.
It's actually Vermont. They have a 20% Vbac procedure, and the lowest one is actually Louisiana. And so this map here, all the black markers are all the hospitals in the U.S. That have Vbac bans or just don't provide services for Vbac procedures. So you can see it's a lot.
So after hearing about all these other factors at play, obviously a big part of this story is the mother herself. So we are going to talk about the mother's voice in this. So where do you guys think, if you think at all that her autonomy is affected by being in this situation, how do you think her autonomy is affected?
I think it's affected a lot because you're essentially being told how you can give birth, obviously. So if it's not offered at all, but you believe you want to do vaginal birth and you understand the statistics, I think it should still be your choice and it's not being given as a choice like that.
Exactly. And, just to remind all of us, patient autonomy is defined as the right of patients to make decisions regarding their healthcare without being influenced by their healthcare providers, and that most importantly requires that their healthcare providers are providing them with the proper information to make such informed decisions.
So, what are the solutions? Let's say if you were the mother, what would you do if you were approached in this situation where your doctor has all these really solid issues that they're saying this, and this is why I don't want to do your Vbac? What is one thing that you would do?
Throw the world of biggest bitch fits. None of those reasons have anything to do with my health. I mean, one of them does, but most of them goes down to them not being sued.
Wait, why?
Well, yeah, so midwife is an option. Another option that a lot of women actually do, and there's lots of different articles about this, they travel far, really far places, sometimes having to travel 6 hours, 7 hours to find a doctor who's willing to do it for them, given their birthing history. And this can cause a lot of problems for the mother because they have to leave their family and their kids, and they have to go travel long places, so it's a big issue. So, moving on to the solutions, that's why we have a loading sign. The solutions are currently not very clear and still being played out. As you can hopefully see, this is a very independent issue, and it depends case by case. It all depends on each different mother. They all have different birthing histories. They all have different requests. So it's very individualistic to the mother, but also to the doctor. It depends on, is the doctor willing to accept the risk of the liability, and are they willing to accept the risk of the complications that could come with the Vbac. So it's very individualistic, which is why it's very hard to come up with just one solution to move forward. One thing, however, that is happening right now is that a lot of big outside organizations like the NIH or the American College of Obstetricians and Gynecologists are coming up with different guidelines to urge the doctors to do these Vbacs and to show that, look, it can be safe if you do it in a certain way, if you have all the staff backed up. So there is currently, very recently in the past 10 years, a movement towards really emphasizing the mother's autonomy, making sure that they have informed consent and listening to their wishes. And because of that, we are moving towards a time right now where it's a lot easier to get a Vbac than it was, say, 10 years ago, but it still is, as you hopefully can see through our presentation, a big issue.
But wait, there's more. So to look at all these issues on a deeper level and even look at them in another situation where perhaps a mother doesn't want a Vbac, but her doctor does, you can look at our website.